This patient was referred to me for endodontic treatment of tooth number 14. Porcelain crown. Patient has symptoms. You can see there's a periapical relucency there. So we went over options as always with the patient. Root canal with a good to guarded prognosis. Usually I tell the patient the prognosis is guarded because of the infection there. No promise or guarantees, of course. We're dealing with microorganisms and bacteria. Sometimes these root canals fail. The success rate for a root canal with an abscess, with an infection, is about 80%. So about 20% of the time, these root canals could fail. And then they require endodontic retreatment. So I go over all of this with the patient. I also go over the extraction option with the patient. It's not the recommended option, but the extraction option would be the next option if patient doesn't want to proceed with the root canal treatment. And patient decided that he wanted to try to see if tooth could be saved. Again, there's a porcelain crown on the tooth, as you can see. And here's the post-op. As you can see, everything went beautifully. MB1, MB2, they're two completely separate canals. There was a DB2 also, DB1, DB2. As you can see, they join apically. And that's the palatal. The apical diameter of the palatal canal was 50, so I placed an MTA plug followed by gutter perchance sealer. We temporized the tooth and referred the patient back to his dentist for the permanent restoration. In this angulation, you can see all the anastomosis between the MB1 and MB2 canals. Look at that beautiful lateral right there too. And again, you can see the MTA plug in the palatal canal, the apical few millimeters of it, followed by gutter perchance sealer. In this angulation, you can see the DB1 and the DB2 canals. So you can see they join apically, but still they need to be instrumented. They need to be instrumented and shaped as though they are two separate canals. You don't want to leave contaminated dentin behind, and you don't want to, of course, leave necrotic pulp tissue behind. So these need to be instrumented as though they're two completely separate canals. Brushing the walls, the canals walls, just to make sure that you remove all the necrotic pulp tissue and contaminated dentin.